If you're within your first month of nursing school, you're probably feeling pretty overwhelmed. And trust me, that is completely normal. We're going to walk through step by step what you should be doing every single week to help get you through this first part of nursing school. So lock in and let's talk about week one. Week one, day one, you'll probably get your syllabus. Your syllabus should pretty much be like your Bible. It's going to tell you what concepts you're doing, what your learning outcomes are, and things of that nature. Your other thing that you're going to want to hold near and dear to you is your calendar, because that's going to tell you when everything is due. So your syllabus and your calendar, you want to lock those in. And you want to kind of get yourself organized. You want to look through your syllabus and look through your calendar to find out when all of your test dates are, any assignments that are due, skills checkoffs, clinical, all of those things. You're going to want to go ahead and jot all of those things down. Whether you become organized with either a regular paper calendar, or if you do something digital, either way, it doesn't matter, but you've got to find a way to go ahead and get yourself organized. You want to learn all of your learning systems, okay? A lot of your things will be in several different places. You might have Moodle, Canvas, or something of that nature. And then you'll probably either have either an ATI or HESI, Evolve type platform, and you're going to want to make sure that you know where all of your assignments are being put, because a lot of times schools put their things in multiple places. So become familiar with your learning management systems and where everything is located, because you got to know where to do your assignments, right? Another thing you're going to want to do is to make sure that you know all of your resources. Back in the day when I went to nursing school, we had like 100 nursing school books. Now everything is online. So know all of your resources, all of your books, and where to find them. A lot of those books have a lot of good information in them that I found that students don't even realize the information is in there until they're 2 or 3 semesters in. And I'm like, don't you remember when I told you about that? And a lot of times they don't remember, because that first week, that first month of nursing school is information overload, and it's gonna be overwhelming, okay? Now, another thing you wanna do is to make sure you kind of get to know your instructors, maybe not personally, but kind of get an understanding of their communication style and their expectations and how they want their assignments and things of that nature, because you'll have different instructors and every instructor is different. That's neither good nor bad, but you just want to kind of get a feel for how your instructors want things. Another thing that you will probably get within the first week is your student handbook. Okay, that usually has all the things like how much your assignments count for, what happens if you have late assignments, what happens if you're late for class, if you're late for clinical. The student handbook is going to be your guide, because it has all of that information in it, or at least it should, okay? So again, you're gonna wanna spend this first week getting yourself organized. And I don't mean making everything cutesy with highlighters and things of that nature. To start off, you just want a basic shell of everything that's going on, because it's probably gonna feel like a tornado going on in your brain, trying to figure out all of the things that you need to do, because it's a lot of information coming at you all at one time. And of course, nursing school is not about knowing all of the information right now. you're not expected to do that or to know that. Your first week is to understand the system that you're working with and not to have it all figured out. Let's talk about week 2. So by week 2, you've probably started going over different material and different concepts, and this is when you're going to kind of try to start building like your study structure. How are you going to study? How are you going to retain this information? What are you going to do? That's what you've got to figure out, right? You don't want to wait until your exam to figure out how you're going to study. By that time, it's going to be too late. So you want to decide kind of day 1, day 2, whenever you start getting that material, decide what you want your study schedule to be. And your study schedule needs to look like an appointment that you cannot miss with yourself, okay? You're investing the time to go to nursing school, so make sure that you invest your study time as well. So if you're gonna study in blocks, figure that out. If you're gonna study every day from 3 to 5, cool, but you need to figure out what it is that you're gonna do with yourself. So here's a couple of things that I recommend when you are doing your studying. So first of all, you're gonna wanna look at your notes just as soon as you finish class, or as soon as you can, right? If you do that right after class, your instructor still should be there, and you have an opportunity to say, listen, when you said X, Y, Z, I didn't really get it, or can you explain it to me more? So you want to go through your notes and clarify and make sure that you have the right thing written down. It shouldn't take any more than 10-15 minutes. So stay after class for 10 to 15 minutes and go over your notes and make sure that you can clarify and you understand everything that's going on. So if you've done that, you've heard the lecture, right? And then you've reviewed the notes pretty quickly right after class. That's 2 points that you've had contact with this information. Now you have a study block. And I'll even go back to say, if you know that your lecture tomorrow is on cardiac per se, you should have already gone over all the information from the syllabus or wherever that information was that told you the resources that you should be looking at. So that's one point of contact right there. You looked at the information before you went to class. That's one point. You went to lecture, you heard it again. That's 2 points. You stayed after class and reviewed your notes. That's 3 points. That's 3 times that you had contact with that information. You see how this is going? How it's going to get into your brain? And then when you get home to start your studying, that's another time. That's 4 times that you've already had interaction with that material. So by then, some things should start to stick. So now when you go home and you're doing your study sessions, this is when what we call active learning comes into play. There's many different ways that you can do active learning, and I'll make another video specifically geared towards active learning and all the different ways that you can do active learning. But let's just say that this particular time you want to challenge yourself to do like a brain dump on a whiteboard. So you're at home, you're going to review this information again from your notes or whatever you use. And now it's like, all right, let me do a brain dump. We talked about cardiac today in class. I'm going to write down everything I remember from the lecture, from my notes. I'm going to write down everything, okay? So you look at everything that you have written down compared to the notes that you have, and you can see where the gaps are. Where those gaps are, that's where you know that you need to go back and study some more. Another little active learning activity you can do is teaching it to someone else. So if you can't take your study material and go and teach it to a friend, the wall, a cat, a dog, whomever, and go through all the information, there's some gaps in your learning and you need to go back through all of the things again. And this is kind of where you'll find which active learning method is going to work best for you. And sometimes that's through, trial and error. I might not be able to tell you the best way to do active learning for you. You also want to begin doing practice questions. Practice questions are going to be golden for you because that's what you're going to be doing when you take your test and exams. They're going to be NCLEX style questions. So you need to begin practicing those as soon as you start getting your material in class. So start small with your practice questions and don't worry about getting everything right. However, if you get the question right or if you get the question wrong, always look at the rationale, okay? Because that is the meat and potatoes, okay? Because sometimes you get an answer right because you were able to guess the right answer, not because you literally knew the right answer. And sometimes you get it wrong and you need to know why you got that question wrong so that you don't do it again. So literally the big message here is that you need to kind of build a repeatable system so that you are not cramming the day before a test. Got it? All right. So now let's move on into the next week, week 3. So this is when you're really kind of starting to, how am I supposed to think like a nurse? So at this point, you've kind of, we'll say memorized, you've kind of memorized all of the information that you need to. You're able to do your brain dumps, you're able to answer questions, and this is when you're going to start kind of saying, well, what does this information mean? Okay? What's happened physiologically? What would I expect to see? What findings would concern me? What would the nurse do about it? What's the priority here? These are questions that you can start to ask yourself because it's great that you have memorized and you're super familiar with all of the information that your instructor has given you, but are you able to apply that information? That's what your exams are going to be checking for. Are you able to apply the information that you know and you have memorized in your head? Are you able to apply it to a real world situation? But anyways, this is when you are training your brain to think like a nurse and not just a student. And finally, let's move on into our very last week. By week 4, by your first month of nursing school, you have probably had quizzes, you've had exams, you've had assignments, you have had all the things. They have thrown you in there and you feel like you are sinking in the water, right? But stay afloat because this is where you're realizing what worked and what didn't work. And that's when you begin to adapt, adjust, and overcome. Okay? If you see that the whole brain dump active learning strategy doesn't work for you, by golly, do something else. If you find that flashcards work for you to help retain some of the information before you can apply it, we'll do that. It's okay to have to readjust. It's not okay to quit, but it's okay to readjust. If you have one bad grade, it's okay. It's not the end of the world. You can bring that back up, but it's gonna take time, effort, and you putting in the hours of studying and getting the work done. That's what it's gonna take. Make sure that you get some instructor feedback. Say, listen, I have done this, I'm doing that. Help me. What can I do differently? Do you have any suggestions? Don't be afraid to reach out to your instructors. That's what they're supposed to be there for, is to literally help you. So do seek them as well. Nursing school, it requires adjustment. The goal isn't to find the perfect study method in 1 week, in 1 month, but you'll be able to refine your process as you go along. And Find out what is literally working for you. Month one isn't about having nursing school figured out. It's about building the habits that's going to carry you throughout your whole nursing school journey. It's very normal to be overwhelmed in this first month. It's normal to be overwhelmed the entire first semester because all of this is new to you. You are literally learning new skills. You're learning a whole new language. The way that you studied for your prerequisites may not and probably will not work in nursing school, and that's okay, okay? You got this. Keep pushing, keep learning. If this video has helped you at all, please let me know. Drop it in the comments, give me a thumbs up, all those good things. And if there's something else that you would like for me to talk about, please let me know in the comments. By the way, I'm Dr. Sherry. I am a nursing instructor. I teach first level nursing students in an ADN program. I've also taught PN students. And yeah, if my content resonates with you, please let me know. Give me a like, give me a follow, all of those great things that people ask for, and I will catch you in the next video.